Hello, parents and caregivers. Today, we're diving into a topic that's both exciting and challenging: potty training. This milestone is a big step for both you and your child, marking a move toward independence and growing up. But I know it can feel overwhelming. That's why I'm here to guide you through the process from start to finish. In this video, we'll cover everything you need to know: recognizing the signs of readiness, creating the right environment, setting up a consistent routine, and even handling the inevitable setbacks and nighttime training. We'll also look at common challenges, strategies for overcoming them, and tips for keeping a positive approach. Let's take a deep breath and jump into the essentials of potty training. Remember, every child is different, and it's okay to take it slow. With patience, consistency, and a bit of flexibility, you'll be able to guide your child through this journey in a way that works for both of you. Section 1. Recognizing signs of readiness. The first step in potty training success is recognizing when your child is ready. Every child develops at their own pace, so watch for these signs to know when the time is right. 1. Physical signs. One key indicator is when your child stays dry for longer periods during the day. This shows their bladder is mature enough to hold urine for extended times. Another sign is if they start to show discomfort in a wet or soiled diaper, signaling awareness of bodily sensations. 2. Behavioral signs. Does your child show curiosity about the toilet or try to imitate older siblings or adults? This interest is often a sign that they're beginning to understand the bathroom process. Some children might even begin to hide when they're going in their diaper, showing they're becoming aware of the bathroom privacy. 3. Cognitive and communication skills. Your child should be able to follow basic instructions, like sit down or pull down your pants. They should also start to understand simple words related to toilet activities, like pee, poop, or potty. If they're not there yet, it may be worth waiting a bit longer until they're more comfortable communicating. 4. Emotional readiness. Finally, is your child motivated? Children often show eagerness to be big kids or show pride in new accomplishments. A child who is ready emotionally may express interest in wearing underwear or be excited about using the potty. These signs will vary. Some children may show readiness at 18 months, while others might not be ready until they're closer to 3. Waiting for your child to display these signals can make the process smoother. Section 2. Preparing the environment. Once your child shows readiness, the next step is creating an environment that sets them up for success. Here's how to make the bathroom a comfortable and approachable space for your little one. 1. Introduce a potty chair. Start with a child-sized potty chair, or an adapter seat for the regular toilet. Let your child explore it without pressure. If they feel comfortable, they're more likely to want to use it. You could even let them pick out a chair with a fun design or color to make it their own. 2. Keep the potty accessible. Position the potty in a spot that's easy for them to reach. Some families place it in the main living area initially, then gradually move it to the bathroom. This reduces the likelihood of accidents while they're still learning. 3. Explain the process. Use simple words to explain how to use the potty. Show them how to sit on it and explain what happens next in terms they can understand. A picture book about potty training can help make the concept clearer and more enjoyable. 4. Use visual reminders. Consider using a visual schedule or checklist. This could include steps like pull down pants, sit on the potty, and wash hands. Visual aids can be helpful for young children who thrive on routines. Creating a safe, inviting potty environment helps build your child's confidence, setting the foundation for a successful potty training experience. Section 3. Step-by-step training process. With readiness signs in place and a potty-friendly environment, you're ready to start the training process. Here's a step-by-step guide to help you along. 1. Build a routine. Begin by having your child sit on the potty at key times during the day, like when they wake up, after meals, and before bed. Set a gentle schedule, and don't worry if they don't go every time. They're building a habit. 2. Encourage imitation and play. For many children, imitation is a powerful learning tool. If they see parents or siblings using the toilet, they'll start to understand how it's done. You could also try using dolls or toys to demonstrate, making it a fun, interactive learning process. 3. Start small and celebrate progress. The first successful potty use, even if it's accidental, is worth celebrating. Reinforce each achievement with a high five, a small sticker, or praise. Recognize that small steps lead to big milestones. Consistent positive reinforcement builds confidence and keeps them motivated. 4. Introduce training pants. Transitioning to training pants is a good way to give them the feeling of underwear while still offering some protection. They'll start to sense the difference between wet and dry, which aids in bladder awareness. 5. Avoid overreacting to accidents. Accidents will happen. Try to stay calm and supportive. Gently remind them that it's okay and encourage them to try again next time. Criticizing or showing frustration can make them anxious about the process, slowing progress. 6. Setbacks are part of learning. If your child is having a lot of accidents or seems resistant, it might help to take a short break. Sometimes stepping back for a week or two can make a big difference, especially if they're feeling pressured. Potty training is a journey of patience, and each successful attempt deserves encouragement. Letting your child progress at their own pace reduces anxiety and fosters a positive learning experience. Section 4. Overcoming challenges and setbacks. Even with the best intentions, potty training can present a range of challenges. Let's look at how to handle common issues. 1. Frequent accidents. If accidents are frequent, consider revisiting readiness signs. Sometimes children need a bit more time before they're ready. If they're ready but still having accidents, gently remind them to use the potty without creating pressure. 2. Fear of the toilet. Some children find the flushing sound or the size of the toilet intimidating. Let them get used to the potty without expecting them to use it right away. Consider a child-sized potty as a transition to the regular toilet. 3. Nighttime resistance. It's common for children to take longer to stay dry at night. It's okay to use nighttime diapers or pull-ups and focus on daytime training first. You can gradually introduce nighttime training when they're consistently dry during the day. 4. Regression. If your child suddenly regresses, try to identify any potential stressors like a new sibling or changes in routine. Approach regression with patience and understanding, and encourage them to get back into the routine when they're ready. Challenges are part of the learning process. With calm responses and consistent encouragement, you'll help your child overcome any bumps along the way. Section 5. Transitioning to nighttime training. Nighttime potty training often comes after your child is consistently dry during the day. Here are some strategies for nighttime success. 1. Start with preparation. Use waterproof mattress covers to protect the bed. This minimizes stress for both of you in case of accidents. 2. Limit evening fluids. Encourage your child to drink most of their fluids earlier in the day and reduce liquids an hour or two before bedtime. 3. Establish a bedtime potty routine. Always encourage them to use the potty before bed. Some parents even do a gentle wake-up midway through the night for a quick potty visit. 4. Be patient with progress. Nighttime dryness often takes longer. It's perfectly okay to use pull-ups at night until they're ready. Avoid pressuring them into nighttime training if they're not showing readiness. Nighttime potty training is a gradual process, and with these strategies, you can help your child work towards sleeping without diapers. Section 6. Maintaining a positive and patient attitude. Potty training can feel like a test of patience, but a positive attitude can make all the difference. Here are some ways to keep things upbeat. 1. Celebrate every success. Recognize even small achievements. Each step, from sitting on the potty to a full potty use, deserves acknowledgement. Rewards don't have to be big. Sometimes a high five or a favorite story is all it takes. 2. Use positive reinforcement. Reinforce their progress with praise. and avoid punishments or negative responses to accidents. If they feel comfortable, they're more likely to try again. 3. Encourage independence. Gradually encourage them to pull up their pants, flush the toilet, and wash their hands. These little tasks build self-confidence and a sense of accomplishment. 4. Don't compare. Avoid comparing your child's progress to that of other children. Every child's potty training timeline is unique, and comparison can create unnecessary stress. With encouragement and patience, you can create a positive potty training environment that empowers your child to learn at their own pace. Conclusion. Thanks for joining us on this journey to toilet training. Remember, there's no one-size-fits-all approach, and patience is key. Celebrate each small victory, and don't worry about setbacks. They're just part of the process. If you found this guide helpful, please like, subscribe, and leave a comment below sharing your potty training experience. Good luck and happy potty training!